medicine physician, Dr. Carly Dugan, giving a presentation about improving health literacy and patient outcomes through communication. You now have 90 seconds to read questions 1 to 6.
Hello there. My name is Carly Dugan. I'm an emergency medicine physician and researcher. I'd like to talk to you today about the importance of consumer engagement in health, an area which has been widely acknowledged in recent years as playing a crucial role in achieving the best possible health outcomes for patients. As health professionals, our clients or patients come to us with various levels of education or literacy, and they may prefer to speak a different language. And these issues can become barriers for them to understand health information. This, essentially, is the issue of health literacy, which is defined as the capacity to obtain, process, and understand basic health information and services, make appropriate healthcare decisions, or act on health information, and the ability to access or navigate the healthcare system, which we all know is extremely complicated. Any client who does not read or write well, has trouble understanding verbal or written communication about health, speaks a different language, or has trouble understanding or using numbers could have trouble with these areas. Studies show that patients immediately forget 40 to 80% of medical information provided to them by healthcare providers, and my own research clearly indicates that health literacy is a strong predictor of health status. Patients with low health literacy have more difficulty recalling health information, and inadequate health literacy can lead to numerous negative effects on an individual's health and well-being, including poor self-care, increased utilization of health services, worse outcomes, and decreased likelihood of receiving preventative care and services. Poor communication by health professionals with patients also contributes to unnecessary readmissions. In response to surveys that have indicated high rates of poor health literacy, governments and national agencies in countries as diverse as the US, China, Australia, and some European nations have now gone on to develop national strategies and targets to improve health literacy in their populations. Health information can be confusing, even for those with advanced literacy skills. It's easy for those of us working in healthcare to forget that we speak our own language that patients can't always easily understand. Most of us can recall times when we believed that we had shared information with a patient and family member or caregiver and believed they understood our instructions, only to later discover confusion or misunderstanding. Communication breakdowns in the chain of care are also a leading factor in preventable disability and death. I teach a session on health literacy at a local college and share examples from my own time in practice. One example I like to share with my students is a study in which researchers asked patients what they know about diuretics, better known to some of you as fluid pills. 52% of the respondents researchers interviewed believed that fluid pills caused fluid retention instead of alleviating it. Another example I use is a story of a patient who was informed that she had Graves' disease and burst into tears because she thought the doctor was telling her she was about to die. This kind of confusion is understandable, but may also be avoidable if we take some extra care with our communication with patients and family caregivers. Regardless of a patient's health literacy level, it is important that as healthcare professionals, we ensure that patients understand the information they have been given. The Teach Back method is one way of checking understanding by asking patients to state in their own words what they need to know or do about their health. It is a way to confirm that we have explained things in a manner our patients understand. A pediatrician I recently did some work with told me, I decided to do Teach Back on 5 patients. With one mother and her child, I concluded the visit by saying, "So tell me, what are you going to do when you get home?" She could not tell me what instructions I had just given her, so I explained the instructions again, and then she was able to teach them back to me. I had absolutely no idea she did not understand the first time. I was so wrapped up in delivering the message that I did not even realize it wasn't being received. Research clearly shows that consultations that include checking patients' recall and understanding do not take any longer than consultations that don't, and they help prevent future unnecessary health service use. It is therefore essential that as we continue to work on improving the safety and reliability of care, we consider deficiencies that contribute to patient harm beyond the obvious focus on acute care in ambulatory settings, to include how we communicate with patients about their treatment plans and their health. Ensuring that we are communicating clearly and delivering information at the appropriate literacy level will be an important step.
With a cardiologist. Listening Part C. You heard an interview with a cardiologist, Mr. Marshall, about saturated fat. You now have 90 seconds to read questions 1 to 6. No.
My guest today is Dr. James Marshall, Associate Dean of Medical Education at the University of Glasgow Medical School. In light of a new report that's recently been published on the subject, we're talking today about saturated fat. So, Dr. Marshall, can you tell us what the difference is in how many experts view fat now versus 30 years ago?
Sure. The low-fat era has finally started to come to an end. The 2015 UK dietary guidelines states, for the most part, exonerate fat and cholesterol with no restrictions on total fat or cholesterol in diet. That is after 35 years of previous guidelines advising a low-fat and low-cholesterol diet. I think there's still a lot of misinformation floating around about saturated fats. Not all saturated fats are bad, and there's some that have all been grouped together and labelled as harmful, so there's still some work to do there.
Can you talk a little more about the relationship between saturated fat and cholesterol levels?
Yeah, sure. We spent most of the last generation looking at total cholesterol and LDL, as if to suggest that these two values give you an accurate reflection of what we now know to be a much more complex and nuanced issue with lipids. But when you get people fat from a quality source and lower their carbohydrates, generally you see their triglycerides come down. That's a good thing. You see, their good cholesterol, the HDL, goes up. That's a really good thing. What you see in the majority of people when you give them a more saturated fat is a shift from the small, dense LDL particles. These are the more risky, inflammatory, atherogenic types of LDL, to a larger, more buoyant LDL particles, which are less inflammatory. Many physicians still aren't aware of this.
And what are your views on saturated fat and its place in the diet?
Well, quality becomes paramount here. The saturated fat in a fast food bacon cheeseburger will have an entirely different effect than the saturated fat in coconut oil. I absolutely love healthy saturated fats in coconut oil and grass-fed butter, and I think these have a place in our diets. Healthy saturated fats can actually help you burn fats. They make your brain work better and faster. They make your skin glow, and they can help optimise your cholesterol profiles. It's very important that you only include saturated fats in the context of a diet that is very low in refined carbs and sugar. Saturated fat and coconut oil. I absolutely love healthy saturated fats in coconut oil and grass-fed butter, and I think these have a place in our diets. Healthy saturated fats can actually help you burn fats. They make your brain work better and faster. They make your skin glow, and they can help optimise your cholesterol profiles. It's very important that you only include saturated fats in the context of a diet that is very low in refined carbs and sugar and includes omega-3 fats. The entire LDL lowering hypothesis has been questioned by recent studies that have found that those who have LDL lowered the most by vegetable oil have the greatest risk of heart attack or death.
Are you saying we should embrace saturated fat and stop worrying about cholesterol?
No, I'm actually not suggesting that. The saturated fat in your diet has very little correlation to the saturated fat in your blood, but we do know that the higher saturated fats in your blood are linked to heart disease. The question is, how do you get high saturated fat in your blood? Logic would dictate that it's by eating butter, but biology is not so straightforward. It is by eating sugar and refined carbs. Low fat, high carb diets trigger synthesis of this type of blood saturated fats that are linked to heart disease.
Why is nutritional science often so contradictory and confusing?
Well, there is contradictory information because the research is hard to read, and of course, if a study is being performed or funded by someone who has a strong opinion, the outcome is more likely to favour that opinion. A lot of experts are also looking at outdated research. These are studies in which people who are eating fats are eating bad fats, inflammatory fats, and junk foods. Well, of course, you would think that fat is bad for you if you're only looking at a study like that. So it often comes back to an individual's understanding of the research.
And why do a lot of organisations and experts still push a no-fat or low-fat message?
Yes, I think that's such an important question. I've been in practice almost 30 years, and I have had very academic roots all along. The structures and organisations and associations that we look to for guidance and advice are not nimble at all. These are run by good people, but there's an inherent bias that these structures tend to embrace. We all know that there are researchers who will lose grant support overnight if they suddenly change from saying fat is bad. They'll struggle to maintain their academic integrity based on the culture that they're in. In all of this debate over fat, and saturated fat in particular, I still recommend filling your plate with at least 75% phytonutrient-rich, colourful, non-starchy veggies. Plant foods, by volume, should take up the majority of your plate.